Thank you very much, Jose, and the august group that has spoken here this morning and this afternoon. It's just been a wonderful, wonderful day. And I was saying to Beverly before, you know, we've heard from doctors and CEOs and policymakers and researchers and even a former president now. And I'm wondering, given your personal story that I hope you share today, what were you thinking during the day as you've lived your life through the lens of what is being discussed here?
Well, throughout the day, I was taking notes, listening to some of the things that resonated with me. I felt honored to be invited to be here to speak, because, you know, a lot of times people making decisions on lives that impact me and my community, but don't often engage us. They do the work and don't include the people. How did I get here today? I'm a survivor. One of the things I kept hearing today is a discussion and people sharing on suicide. And my thought was, I wish they would talk about domestic violence a little more. When I was 19, I had a partner. Someone I was with was my perpetrator. And I was outside, as we say. We have the saying in New York, we outside. I was outside, not living, was living on self-destruct. I wasn't home. There was a lot of risk factors as how I got to that point. And the person that I was with shot me in the head. And I still carried the bullet in my left mastoid. And because of all those risk factors and all those things that had happened before me to this point, after the fact, I still went to be with him. This person shot me so close that I was picking gunpowder out my face in the hospital. And made excuses. I didn't tell law enforcement what had happened. I told them somebody tried to rob me. I covered everything up. And it's only recently, I would say, in 2021, while with the Soul Box Project, we were doing an exhibit on the National Mall of the Soul Boxes, that I sort of said it out loud. There are people that know me for a long time, and they're probably tuned in right now. This is probably the first time they're even hearing this. Because, you know, people don't know. If people know that I got shot, I always say, oh, somebody tried to stick me up. They didn't know it was somebody that I thought I had loved, or I thought who loved me. And I survived that. And like still to this day, it impacts me, how I engage in relationships, how sometimes I'm metabolizing my anger. It's still there, it's lingering. And I tried so long to get the help that I need. Talk to the healthcare. On a mission trying to get mental health care, on a mission. I'm still on a mission. Like the access is, I hear what you're saying, but I'm from the Bronx, it's not real. Like, when you going through something, you on a waiting list for like 6 months. And hope to God that is even the right type of mental health care for me to talk to somebody, right? But sometimes talking is not it, because if the body keeps the score, how do you talk it out? If that trauma is like embedded into your DNA, how do you somatically deal with it? And going through those experiences. And I'm just saying, you know, it's a struggle. Just recently, I'm trying to find some services in the Bronx. I still haven't. I still haven't found what I'm looking for. It's hard. Mm-hmm.
Thank you. Your story is very personal, and I hope that as you spend the day with us today, and as our audience is listening to you, of how what was discussed is so very important. And you were shot when you were 19. Mm-hmm. Today, you're still struggling.
Still looking.
All those years later.
Yes.
But you have taken that struggle and that pain, and you have done some unbelievable things. You mentioned the Soul Box Project, which is on display outside, the work that you're doing at the Bronx Space. Tell me about how you're using art and how you're channeling your struggle, your pain that continues today into these other creative things to make a difference.
All right, I want to lay out a timeline, like how I even got there.
Sure.
Because it was school and parent engagement with Children's Aid Society, which is now known as Children's Aid NYC. Walking in the Bronx, you often see these makeshift memorials of someone who was shot. And raising my son, I was like, my son can't be no RIP sign. But somehow, I guess, like, from reading stuff, seeing things on TV, I correlated his education with his mortality. I said, look, if he gets a good education, maybe it'll give him a better chance at not becoming an RIP sign. But I didn't have no educational, I was not equipped to support him. And so when the teachers kept saying, oh, his reading grades are low, and I'm asking them how are they gonna help, because I knew the education and schools had something to do with prison and violence. I didn't really understand it because I wasn't really educated. So I started to go and just like ask for help, and then I met someone from Children's Aid Society. I was part of some parent group, and they reached out and said how they could help, and then I winded up in a community school, which is like really different, like it's community. And I would follow the parent coordinator around, like help me, help my son, help me, help my son. And I just became a fixture there, and they sort of mentored me, and we did learning leaders, and then they had me running meetings. They sort of taught me a lot of the skills that I carry with me today. And then they put me on something called a Positive Deviance Project, and I was doing all this parent engagement, and they said, Beverly, you should go to school. I was like, I ain't going to school. Huh? What am I doing going to school? And my son was graduating at the time, and I was like, oh, you're going to graduate, making such a big fuss. And my son asked me, Mom, when you going to graduate? Because kids will blow your spot up. They will blow your spot up. They will have you do this self-assessment.
Yes.
And so it was sort of, I guess, the confirmation. So I went to the Bronx EOC to get college prep. It was a journey. And then I got in school the first time, testing. I went to Bronx Community College. I became student government. I was the first recipient of the Cleve Browder Memorial Scholarship.
Wow.
Then I joined University Student Senate. I became one of the students that represented the whole CUNY system. And then I went to Hunter. And then while at Hunter, I came into contact with the Welfare Rights Initiative. And, worked with them on some policy work, which I will get to. But I'm going to get to this timeline as far as art. I had to get some credits for a class, and the internship winded up being at Bronx Art Space.
Oh, boy.
Right? This is about 7, 8 years ago, not even counting. And I noticed, so where Bronx Art Space is in the Mott Haven section of the Bronx, but it's surrounded by public housing. But people, I would walk around, that's my MO. I walk around all day. I'm just on the bus talking to people, that's just what I do. And I noticed, and I was like telling people, hey, have you ever come visited Bronx Art Space? And people would say, hey, that space is, sometimes I would hear it's for white people. It's for the more affluent people. And I was like, what's going on? The alienation from arts and culture. And I was like, I gotta get to the bottom of this. So I went back to Hunter. They did a community analysis trying to, and just working really hard because I had found some maps from NYU with some research, I think Furman Center, and it was some evidence that art correlates with public health. So I was like, I'm staying here. I don't care if they don't pay me. I don't care. And I wound up just staying there for 2 years, just helping, and eventually I was hired. And then I kept telling my director, this gun violence, we need to do something on gun violence, like an exhibit. And some time had passed, and 1 year they said, okay, we're gonna curate an art show on gun violence and you're gonna do it. I was like, okay. And they allowed me, and they guided me, and I did an open call, and then I looked for interactive activity because I said, what if people are coming in, they're touched, I need something for them to do, like some interactive, and I found the Soul Box Project online, and I reached out, and I said, hey, can I, because I learned from college, you have to reach out to people about their intellectual property, right? I don't want nobody to come get me in Bronx Art. Oh, somebody took your stuff. And so that led to having that in the gallery and being with the artists, because the artists, I never did an open call. So even the artists in the show, I was learning from them. And this exhibit winded up being a large, I believe I think it was 2021. We did an exhibit on the National Mall, like over 200,000 boxes, people folding, and it gave people sort of like a visual, and they were compartmentalized, like suicide, so people could sort of get numbers on the impact of gun violence.
That's amazing. I knew of your story before we sat down, but every time you tell it, I learn something new, and how your journey has brought you to being here today.
Yes.
So if you were to sum it up and you leave this audience with one thing, what would you say that is?
Wait a minute, my time is up already?
It went by fast.
I'm going to answer your question.
Sure.
But I just need to comment on something that was just said about being together and community.
Yes.
Right?
Yeah.
And how it's important for inclusivity.
Yes.
And looking for our likeness versus our differences is really important. Quick story, I'm going to answer your question quick. So because of the exhibit, there was an artist named Tasha Duje that had a piece that had something to do with kintsugi. I know what kintsugi was. But I found out it was a Japanese art form of embracing your brokenness. So when you see these vases, the ceramic and this gold lining, is this concept of that is embracing your imperfections and things that build character. And I became obsessed, and I started, what's kintsugi? I need kintsugi. I am kintsugi. Really. I'm embracing my imperfections. So I found this woman on YouTube named Azumi Uchitani. And I said, I'm going to call her. I don't know where she at. She was in Netherlands. This is during COVID. She sent the Chinese Dutch internists come to the Bronx. And Faye stayed with me for 2 weeks talking about kintsugi.
Oh, wow.
And Azumi's about to come back to the U.S. She's been to the Bronx 3 times.
Wow.
And this is just the power of art, because this kintsugi, I then got an art grant, and then I was taking it to the community. Like, people have experienced violence and, right? But when Azumi was here, it was a time that they was having the Asian hate, all this Asian hate was going on.
Yeah.
And she spent time with me. And to have two women from two different cultures and find the sameness. And I'm just sharing this because it's about how we are alike. And how we are alike is family. We believe in family, and I think that's where we need to start, right? Because look at our families. We're eating alone. We're not spending time. Yeah. And I believe that the separation of the family sort of correlates to our society, right? And if I had something to leave you, if I had something to leave the healthcare profession, I would like for you to think about art is a tool to help facilitate complicated conversations, right? It's also used for healing. And I'm not just saying art, painting, drumming and singing. That's all in our ancestry. If we look at our grandmothers and this was something that is sort of removed. We're a culture to think individual. So it's challenging being here in America because be an individual, but it's about family. And I just want to tell the healthcare system that really look at art and how it overlaps in health, how it correlates. Reimagine the healthcare system. Reimagine like our ancestors. Prescribe food, prescribe art. And Urban Health Plan in the Bronx has an art desk. They are prescribing art to their patients. They're building a database so they could sort of match. And I want you to reimagine what it looks like. It's not just a prescription.
Well, that is a great last word.
That's the last word?
Last word.
Look, I'm a board member of the Soul Box Project, so I gotta say this. We're out in the lobby. It gives visibility, right? So we're here today. Want you to take a look, go talk to Leslie Lee, my colleague in the back. And a lot of people have adopted this, and we want this to sort of expand. And thank you for having me here.
Thank you very much. Thank you, Beverly.